And I know him since long years, and he has been in my lab several years ago as a postdoc and was even teaching in German, so we have very good experience together and a good friendship. So coming here to this extraordinary event in this magnificent auditorium really is a very outstanding occasion for me to present you something about our thinking, about our doing in phytotherapy in Germany and in Europe. And the example where I'm going to present you what we understand in phytotherapy is the treatment upper respiratory system in RTI, respiratory system infections. So, next, So I have to start with some definitions, really. What do we understand by phytotherapy in Europe? Prevention treatment of human diseases using plants, parts of plants, or preparation of plants, you can read it all, which are defined as an active substance in its entirety. So if you use one part of a plant, extract of a plant, this is the active substance in its entirety. This is very important. And the therapeutic application of these isolated plant constituents is not phytotherapy. So if you take out one of the active principles, for example, the famous artemisinin out of Artemisia, this is no longer phytotherapy, this is a normal therapy. And we have clearly to differentiate homeopathy and anthroposophic medicine are not considered as phytotherapy because some people, they really put it together. Homeopathy, well, it's made of plants, it's some kind of phytotherapy. It is not. It's clearly separated. This just for explanation. And we distinguish different categories of herbal products, and I'm going to talk about only the one line, the medicinal products. Dietary supplements are not considered as medicine. We don't have much in Germany. In other European countries, you have dietary supplements, nutraceuticals, botanicals, or how you name it. Why? Medicinal plants are under strict control. They are controlled on the basis of the pharmacopoeias, and this is really necessary if you want to register those products. So, why to control? There is always a certain risk potential of herbal medicinal products, and this risk potential is for the safety of the patient, and it has to be avoided in any case. I have listed up here some of these risks. False botanical identification, very important. We had some even fatal outcome in the last 10, 15 years if the herbals were false identified. Contamination is very often observed with heavy metals and so on. You can read it here. Adulterations with chemical compounds, and this is very important. If you buy phytomedicines via internet, they sometimes contain chemical compounds to mimic a pharmacological effect, which is not bound to the plant material, but to the synthetic compound, which is mixed with the plant material. And then we have to consider the adverse reactions of some of these herbals, medicinal products. They might be allergic, they might have gastrointestinal interactions, and they might interact with synthetic medicines. All this has to be considered when we use these herbal medicines and when these medicines are being registered in the national authority, or by the national authorities, or by the EMA in London. So the EU has defined the herbal medicinal products as products which contain comminuted parts, extract, pressed juices, or distillates. So all these different possibilities you can define as herbal medicinal products. They must fit in this scheme. And to guarantee the quality of these products, we have a very stringent outline. We have first the proof of quality by validated methods in the European Pharmacopoeia or the national pharmacopoeias, very important. And then the proof of efficacy and safety. This is done by monographs which are established at the moment still in London at the EMA by the HMPC. They provide the efficacy, safety, and the safety for the patient, very important. I mentioned just which problems we might have. And altogether, all three, efficacy, safety, quality, this is the basis for all kinds of registration. But prior to this, you have to establish the monographs on efficacy and safety, besides the monograph on the quality, which is done in the HMPC Working Party in London. It moves, as you might know, to Amsterdam in the near future. And then you have a monograph where you exactly know if you treat one of these or use one of these plants, which are the real expectations based on scientific data. The requirements for herbal medicinal product registration can be seen in the following scheme. Well, this has been published several times. You might know it. You can register it as a new, as well established, or as a traditional herbal drug. And the basis of this all is the guaranteed quality, which is guaranteed by the European Pharmacopoeia, the quality control. Then the safety, efficacy. And for the new, you have to make new trials, new tests. For the well-established, you have to demonstrate bibliographic and safety data and efficacy data. And for the traditional ones, you have only to demonstrate traditional use for a certain period of time in Europe and maybe in a non-European country. And then the products can be registered, or you get the marketing authorization. So traditional are always being registered, and the others have the marketing authorization. This is very important. Now coming to our topic, the infections of the respiratory tract. If you have a look on the top categories in Europe on the total herbal market, you can see that 23% are cough and cold. Herbals being used, almost a quarter of the total for cough and cold. So it's a really important field. Important fields, RTI, respiratory tract infections or common cold, which is caused by more than 120 strains of viruses. It's mostly viruses and it's rarely bacteria. As you know, it's highly contagious. It's localized in the upper respiratory tract and normally remains in the respiratory tract. Everybody is informed about the symptoms, nasal, cough, cold, pharyngitis, tonsillitis, and so on and so forth. So the symptoms vary quite often. And if you have a look on the most common cold cause for visiting the doctor, indeed, are the RTIs. Mostly in children, it's very often they have it 3-4 times a year, the viral infection, because they have many contacts in the kindergarten, in school, and so on and so forth. So the viral infection is spreading very rapidly amongst children, and this is one of the cases where the doctor is being asked, what can we do? And the doctor certainly, and all the scientists are aware that there are many symptoms where the RTI are caused by rhinovirus infections, and the symptoms vary quite a bit. Mostly it's rhinitis, starting with rhinitis and headache, sore throat, cough, fever, muscle pain, and so on. This you always find in RTI, and you must try to really cure these symptoms. But unfortunately, it mostly does not stay only in the rhinitis. It is followed up by other parts of infected organs, otitis, sinusitis, pharyngitis, tracheitis, bronchitis, obstruction, and so on and so forth. So it's a sequence of events, and hopefully you can stop it at the first part in the rhinitis when the rhinovirus has had its effect on the patient and mostly on the child. The common pathogens on this are known nowadays. I told you already, it's virus, mostly rhinovirus, but others can act as well in more or less the same way and causing rhinitis or influenza directly, or pharyngitis or bronchitis. We are fully aware of this, and for this reason, it's not useful, as we will see, to start a treatment with antibiotics. The first treatment option should be watchful waiting, because even untreated, this RTI goes away in a few days, but if you get the sequence of effects on different organs, then you should start with the treatment. The complications might then be caused by bacteria, but most cases it's only the viruses, the primary infections. So the treatment options, antibiotics, are not the therapy of choice. As you can see here, only in 5 to 10% bacteria are the cause. And bacteria, if yes, they can, the antibiotics can be used for the treatment, but if only the viruses are the cause, it makes no sense. And you know all the consequences, and you know the need for alternatives, off-label use of medicines, and so on and so forth. So we have to look for alternatives, and these alternatives really lie in the field of phytomedicines, phytotherapy, and they are used nowadays by pediatrics, by internal doctors, and so on and so forth. All these doctors who get in contact with patients having RTI. So we have different classes of herbs which contain mucilage, which contain essential oils and saponin, and these are the most commonly used groups of herbal drugs with these ingredients against rhinitis, sore throat, dry cough, and so on. And I will show you in the following where they are located, how they are being used. The classical application, as you know, is a herbal tea preparation, and it's still very useful if the patient, even the child, takes these hot water preparations. It helps in the first instant if you make a decoction, infusion, or maceration. And this herbal tea is prepared immediately before use. And I was yesterday in a wonderful workshop how to make these medicinal teas by Professor Demirci, his wife, and this was very helpful, and there were very interested audience who really followed, and I think in the future this area of herbal tea preparations and Turkeys should be underlined as a very helpful method to cure, not fully, but at least the initial phase of RTI. A more modern method, a more modern mode of application is the use of granules or instant teas. They have some advantages. If you make them at home, you can readily take the powdered tea material or the extract of the tea, which is standardized, and it's uniform, and it has a constant composition. This is very important. You can really depend on what you have. If you have a spoonful of this powder, dissolve it in hot water, take it as a tea, it's very good. Then the granulated teas, they often are preferred by the patient because they contain less of the extract and they sometimes taste better than the instant teas. So granulated teas prepared after modern galenic methods, they are very good for mainly children or so for the treatment of RTI. Now, traditional tea mixtures, you will find it in each pharmacy in Germany where these mixtures with the composition which is mentioned here is being used, and they are even laid down in what we have the national formulary, and so every pharmacist, if this is written down by a medical doctor, knows exactly what to take and how to take. And all these herbal drugs are being controlled, the quality is controlled according to the European or the German pharmacopoeia. And the amount which the classical method is written here down, 1 tablespoon, and so on, with hot or boiling water, and let it dim and prepare the tea at home as you want it. Cough tea, that's a classical tea mixture as well for all the symptoms of bronchitis and catarrhs, very helpful just at the initial phase. It helps in any case. And here you have seen the active ingredients which in the first line are the so-called mucilages. These are high molecular weight polysaccharides, which you find in many herbal drugs, for example, Icelandic moss, marshmallow, mallow flowers, and so on. They have these components, how they act, I will show you in the following. The antitussive effect of these plant mucilage is against the irritation or inflammation of the oral mucosa, pharyngeal mucosa, and they are protecting the mucosa against the influence of bacteria, and sometimes they can have in addition an immune modulatory effect. They always used oral administration, liquid administration in defined extracts or in teas. Here you have the next group, the essential oil containing herbal drugs with antitussive extract, mostly utilized in the case of dry cough, eucalyptus, thyme, fennel, anise, and so on and so forth. They have defined expectorant, antibacterial, cicatricitic, and so on and so forth, defined activities against all these symptoms which are common with RTI. Finally, the antitussive extracts can be traced down to the pharmacological properties of these essential oils: antimicrobial, anti-inflammatory, secretolytic, spasmolytic. So a whole series of effects is really correlated with these essential oils. The last group are the expectorants, which have secretolytic, mucolytic, secretomotoric activities, and this group are the so-called saponins, and the saponins are complex structures. I will not bore you with the structures in detail. For example, ivy leaves, prime root, licorice roots, sapwood root, and so on. They contain these expectorant components which are really helpful. They must be taken in mostly as an extract or a defined tea, and they will help via, as it is written here, pharmacological properties, decreasing the viscosity of the mucus, increasing the secretolytic activity, and really expectorant activity, and they do not act spontaneously. You have to take it over a certain period of time, and then they will help really good to reduce the cough. Mode of administration, again, is extracts or as a tea. Herbal extracts for industrial use, for industrial preparations, are the galenic form of choice. The herbal extracts for the treatment of RTI are now quite many in Germany, in Europe as well. For these, you need the standardized extracts, the effect of which has been examined in clinical studies in order to be licensed afterwards. They can be registered, as I have shown to you, traditional, well-established, or new medicines, and the 2 or 3 examples which I will demonstrate in the following are, as a matter of fact, new and well-established herbal drug mixtures in form of extracts. There are still problems related to the utilization of defined extract. In some cases, the active principle is not known. One is only aware that the extract itself has an activity, but to which compound it's related is not known in detail. Mostly these extracts have a lack of pharmacokinetic studies, unfortunately. Sometimes the lack of stability. This can be overcome by real good galenic preparations, and some of them even have a lack of clinical studies, but the ones which I'm going to show to you, they have on the back real good clinical studies demonstrated in order to be registered. And these extracts, they must show conformity, and we talk about the so-called phytoequivalence. So from extract to extract, you must have the same quality, same type and concentration of the extract, same manufacturing process, quality, fingerprint, and so on and so forth. For this purpose, we have described in the European Pharmacopoeia a whole series of extracts defined according to all these parameters, the extracts which then can be used as such or in mixtures. So I give you now in the following 2 or 3 examples of registered herbal extract preparations from 2 companies. The first one is from the Schwabe company in Germany, using pelargonium extracts. And the second one is the company Bionorica with a very successful cyanoprete and bronchiprate products on the market. They are used as OTC products, or they are being prescribed by the practitioner or the pediatric doctor. I start with the first one, pelargonium extract. It's registered in Germany as Uncaloabo. It derives from a geranium plant, Pelargonium sidoides, which is cultivated in South Africa and exported from South Africa. You can't grow it in Europe. You need the special climate of South Africa. And this is very good example, and this is proven in pharmacological and clinical data, antiviral, antibacterial, and secretomotoric effects which are bound to this preparation. This extract is named EPS 7630, but the name is Uncaloabo, under which it's registered in Germany and is sold worldwide almost in many countries. The product profile is the following. You can see here the details, dosage and so on. The dosage is very clear for adults, for children and so on. No contraindications. It's used for the treatment of acute RTIs, and it has a very good intensity score. Against nasal drainage, sore throat, and so on, the major symptoms, minor symptoms, all is proven on clinical trials, and clinical data exist. So the antiviral data, antiviral immune modulatory effect, viral attack is clearly demonstrated. Antibacterial effect is clearly demonstrated by ingredients of this extract. And finally, the secretomotoric effect, which is very essential for the treatment of RTI, are even demonstrated for this extract. Against viruses, the direct antiviral effect, very important, protect cells against virus-mediated destruction, activation of NK cells as well. So this is clearly proved. Against bacteria, if present, a direct bacteriostatic effect has been shown, and this is important as well. Against mucus formation, the nasal mucus the formation is reduced. This has been demonstrated, and this is an additional effect which is very important. So you have 3 different forms of effects: antiviral, antibacterial, secretomotoric, and secretolytic effects, and the sum of all these makes a very positive outcome of Uncaloabo, this pelargonium characterized and clinically proven extract. Next one is cyanoprete extract. This is a product from Bionorica. I think this is marketed as well in Turkey as well. And here we don't have a single plant phytomedicine. We have a composition of 1, 2, 3, 4, 5 herbal drugs which are being extracted together to give a defined extract, which is defined for the ingredients and so on and so forth. So for extract to extract, the phytoequivalence has been demonstrated. And here we have similar effect to what I have shown before with this pelargonium extract, with a single plant extract, microbial infections, viral effects, causes, collateral damages, and so on. So mucociliary clearance and inflammation. So it's a very potent combination of herbal drugs useful for RTI infections. And this extract inhibits viral replication, clearly shown in vitro. It has secretolytic effects in vitro, very clearly shown, and this is a very important effect. And based on all these data, it has been registered as a new medicine, even being composed of 5 different herbal drugs. Secretomotoric effects in vitro, very clear-cut data presented, so there's nothing to say against this. And if you look at the final outcome, the RTI disease can be shortened by considerable time of treatment, with treatment, without treatment, against placebo, so the result is very clear-cut demonstrated. The summary of the company is that this is the first study of a herbal product in acute rhinosinusitis and with a significant reduction of MMS at day 15, supported by, and so on and so forth. So evidence, this is always what is being asked, evidence has been reached. And the final one I'm going to present very briefly is by the same company, Bronchiprate. This is again an extract by a series of different herbs. They were been mentioned before, and they have the similar effects, but more on the line of anti-cough. It leads to collateral damage. Cough is being reduced considerably in contrast to Sinoprate, and therefore it's Norica first product in this area of anti-cough remedies. And no other herbal or chemical synthetic product is recommended. In addition to that, though, really, this has been documented, and I think this is a real step forward in phytomedicine, that this has been proven, and the proof of that by clinical studies has been recognized by the national authorities in Germany. And even the national authorities in China now have registered this product based on these data. So I think this has a worldwide really impact on RTI infections. Now coming to my conclusions, phytomedicines for the treatment of RTI have demonstrated a most successful history in different galenic forms and formulations. This is indeed true. Traditional use of the tea preparations are still valid and should be used, primarily used. They might help, but if the RTI is persistent, then you need those phytomedicines as additional medicine, and the quality parameters being guaranteed. So I think this is very good outlook for the future. Thus, the future utilization as prescribed or OTC phytomedicines for the treatment seems to be well-based, and this can be demonstrated for another series of ready-made medicines on the German market. I just picked out these three to demonstrate what is feasible, and others are being examined in the same way. So we have a broad spectrum of now registered plant phytomedicines for the treatment of RTI, and this is the best outlook for the future, to have good medicines which are well tolerated, which have almost no side effects, and they're suitable for children. And I think this is a very good conclusion, that this should be not only limited to Germany, but this should be spread out over Europe and the countries where it's needed. Thank you very much for your kind attention.
Thank you very much, Professor Franz. I invite you to sit on the